Okay, thank you. Our next speaker is Maha Tahiri. Maha is an adjunct professor at the Friedman School of Nutrition at Tufts University. Maha has served as a Food Forum member for the past 5 years. She brings her expertise in nutrition, as well as extensive leadership in the private sector on nutrition innovation and health to this discussion, focusing specifically on elevating the role of nutrition in sustainable food systems. Maha, the floor is yours.
Thank you. Good afternoon. I think considering the activity we had, the food coma is gone. The purpose of my talk today will be to try to make the case for nutrition-sensitive value chain interventions. And Jessica mentioned it earlier today when she was talking about what actually would be something that the policymakers would take into account. And the background of it is most of the interventions in nutrition historically would focus for their outcomes on increasing the yield or increasing the calories or increasing the well-being of the farmer or of whoever is the beneficiary of the intervention. I would say probably 10 years ago, or maybe a little bit more, the concept of the nutrition-sensitive value chain emerged as a concept to say, okay, what gets measured gets improved. So if we put nutrition as the outcome of the interventions, and if we link the whole value chain, maybe we would have a different success and efficiency. So this is a long definition of the nutrition-sensitive value chain that came from a workshop that was done by FAO, by the Rome-based agencies, NFPRI and IFAD. And the thing that's really struck me is it really goes from inputs to preparation and consumption. So it is the whole value chain. It includes all the stakeholders. It's a coordinated, and the coordinated is very important, production and value-adding activities. It is meant to enhance the supply and or the demand, and we will talk a little bit about that, to add nutrition value or minimize food and nutrition loss at each step with the aim of increasing availability, affordability, quality, and acceptability of nutritious food. And at the last sentence, this approach must be placed in a sustainable context. So sustainability is there, but as you can see. Just to talk about why actually there was some literature to press test actually the previous way of doing interventions, and there are a few papers that actually looked at the interventions the way they were done and how efficient they were. And the first paper that the maternal and child nutrition is really a very important paper that was done by the Lancet Nutrition Intervention Group and the Maternal Child Nutrition Study Group. And what that paper showed was in 2008, 36 countries representing 90% of the global burden, and it implemented the 10 evidence-based interventions, we would not achieve the global targets. In 2013, they did the same thing, and they showed that if we implement the interventions as they are done, the best interventions that we have, and that could go from breastfeeding or fortification or community interventions, if we implement that in the 90%, again, the coverage of the countries that has the most burden of malnutrition in the world, we would only have, it's difficult to say only when it comes to death, but it's only 15% of the death that would be avoided, and only 20% of the stunting that will be decreased. So the Lancet group concluded that nutrition interventions should be combined with nutrition-sensitive approaches, and what they said as complementary to those approaches was women empowerment, agriculture, food systems, education, employment, social protection, and safety net. Another paper that I want to highlight here was really truly on the impacts of agriculture on nutrition. That paper by Eileen Kennedy and Patrick Webb took 10 very well done interventions and looked at was there the plausible that we could say, okay, it's plausible if we do really an intervention that would have an impact on nutrition, that we would see that. And unfortunately, they didn't see that. They didn't see, and what they were saying is that the empirical evidence for plausible and significant impacts of agriculture on defined nutrition outcome remain disappointingly scarce. What they also said is that evidence of absence does not mean that the absence of evidence. And they also highlighted something that was really very important, which is we're trying here to correlate two huge things: agriculture and nutrition. Wow. Unless we have really very, very specific thing in agriculture that we are trying to connect to nutrition, these are huge domains. So it's absolutely, it makes sense that we don't find really specific specific correlations. So that's the strategy. So to move on the strategies for nutrition-sensitive value chain, what I really, really like about it, it's a really nice way to unpack the complexity of the food system into different parts where actually you could see where depending on the situation, whether it's an increased supply or increased demand, how in each step you could impact to increase nutrition, and it's also a way to match the nutrition value chain with the market value chain, which is really very important, because if we can, so earlier today we were talking about insects, and Adam said, well, if you're trying to make a bar of insects, I'll talk to you, and you're not. My advice to you would be not to do it. But what if we frame the question of increasing the demand of, if we get rid of all the issues of food safety, what if we frame the question to increase the demand of saying, okay, how about increasing the insect in the feed of animals? Is that a more acceptable objective or goal? And then we will work from there. I don't know. So it really helps, I would say, help formulate the right question, or push people to formulate the right question, and then look at the problem in a very expansive way. Things like in the first one, in the input, labor-saving methods were things that really I also liked seeing, because labor-saving methods means more time for the moms to take care of their kids and to take care of their child. So these are things that we could do at the beginning. Rural transport policy, refrigerated transport. So it's a nice unpacking of the food system that allows. And it's also then we could also say, for sustainability, what are the parts of these of this scheme that we could act on for sustainability. So the strategy depends on the scenario. Again, it depends on if we are in a situation with a high demand, inconsistent supply, then you would really work on this side of the the chain. At the opposite, if you are in a demand constraint and consistent supply, you would work really more on the marketing and the trading. High demand, consistent supply, which is here, but it's fairly okay. So then we would probably focus on just ensuring that we have a food safety, our food is safe along. And in a situation where you have demand constraint and inconsistent supply, it's probably means that we need to work all along the chain. Now, I just wanted to give one example and one proof of concept on the nutrition value, nutrition sensitive value chain. So this example was research funded and initiated by IFPRI in multiple countries, Uganda and Rwanda. And it was actually set up as a research, and of course it did benefit the people and the household, and 1,200 households that actually were the beneficiary of this activity. Beans are really very important in these countries. So the researchers, there were I think 3 PhD students, 5 master degrees, and they really worked on all the chain. So on the field trials of new varieties, they trained the farmers on the spacing of the rows. They really trained them on how to maximize the way they were planting the beans. They trained them also on on technologies of, for example, for storage, on how to make their storage anaerobic, because they were losing a lot in their storage because the storage was not appropriate. And then they worked a lot with them to understand the market and say, okay, well, when you go and sell individually, usually like a seller a farmer would see 2 to 5 sellers and would sell to 1 or 2. And in one day, 10% of the farmers actually would sell their beans. So they worked with them to pool and to collectively sell the beans. And then in that case, 83% of the farmers actually sold their beans. They worked on negotiation skills. They worked on increasing the demand from other countries, from South Sudan and Kenya. They really looked at all aspects in how they could improve use the whole value chain to do that. They worked with startup companies to come up with other food forms, like a soup. So it was really a beautiful example of using the. But again, it's not. There's no control. It's not. I can't say that we have the evidence, etc., for a nutrition-sensitive value chain compared to the traditional way of doing the interventions. So the best that I could find, to my knowledge, maybe others in the room know other studies, is a proof of concept. And I love this one because it's it actually, there's a value chain that existed. It's the laiterie du berger in Senegal, in North Senegal. And it really, there is a value chain of dairy. It existed before. It's pastoralist, semi-nomadic herders that actually bring milk to the laiterie normally, but that supply of milk to the laiterie is not very constant. It depends on the season, etc., etc. So the intervention, and there was a control group that they did, was okay. We are going to for the pastoralists who are going to provide us a constant supply 5 days a week of milk. We're going to give you a fortified yogurt for your kids. And the fortified yogurt was given actually the next week after they have proven that they've given 5 days the milk. To the mom, again, the women were at the center of the intervention. Anemia was, at the baseline, was 80%. And at the same time, in the whole country, there was a behavioral communication change approach on fortified products. And the results were quite interesting because they could see that there was an increase in the intervention group of hemoglobin after 1 year. I mean, they choose to work on children that were between 24 and 59 months because it was easier not to work on very, very small children. They had more impact on boys than on girls, but that is known in the area of iron deficiency. Anemia was decreased from 80% at the baseline to 60% at the end of the study, and it was not the case in the control as compared to the control. So that's what I would say really a good proof of concept of a nutrition-sensitive value chain intervention. All right. So in conclusion, my considerations in this is, I think one of the most important things for the success of the interventions is a very, very clear definition of the nutrition problem and therefore of the nutrition goal. An expansive search of the solution, which actually the framework helps with, but really look for solutions that in a way that is very creative and but needs to be applicable in the context and locally. Coordination of the whole chain is key, and sometimes we say it's key, but sometimes it's just simply not possible because, I mean, for example, if there is no transport so it's key, but we have to work with what we have. Adding value to all the actors along the value chain. That is also why I really like the laiterie du berger, because the laiterie du berger had an added value of having a constant supply of milk, and the herders had an added value of actually having the milk, and of having the fortified yogurts for their kids. But in a general manner, I think we could say we could be in the configuration of companies. A lot of companies have philanthropic work that they do in Africa, in India, in the US, etc. But that will always be limited. That will not solve the big question that you all had on the wall. I really believe that it is what would solve that question is if we can have solutions that will have value for all the actors along the value chain, including the private sector. Adopt a consumer-first approach is the best way to increase and create the demand. So really a better understanding of the consumer or of whoever is at the end of the value chain is very important. And we were talking earlier on the sustainability. So we assume that everybody would agree that we have and we want a sustainable diet. So we've done, in my previous life, we've done some consumer research, and people, say yes, we would like to have sustainable diets and sustainable products. but they don't buy it. When it comes to really buying the products, they don't. What we found was truly things that actually they did buy. It's when you really find something that is very specific, that really is close to their home. And for example, the pollinators, when you talk about bees to people who are really in the US, and then they understand it, the bees, if the bees are not there, then the pollinators, blah, blah, blah. So that is very specific and very clear, and then they would really embrace it. So the understanding the consumer needs to be very, very deep, and not just. And then, of course, you all talked about it a lot, influencing the policy to elevate nutrition in the agenda. And when I say that, again, it's about transportation, it's about building infrastructure, it's about all of the above. And last but not least, when we say engage the private sector, it's from large vertically integrated multinationals to individuals who transport, store, aggregate, or sell food. So it's a range of the very small to the very big. Thank you.